The leaked letter from the executive of the St. Lucia Medical and Dental Association addressed to Prime Minister Alan Chastanet dated 19 February 2021 outlines the strategy of the medical fraternity to halt community spread of COVID-19. The St. Lucia National Emergency Strategy comes against the backdrop of the alarming rise in cases of the virus and sharp increases in hospitalization and deaths. The document notes, quote, "There is a rapid rise in case numbers with widespread community transmission, reflected by 1. Increasing positivity rate, increasing hospitalization rate, and increasing morbidity and mortality," unquote. Using the data of February 13, 2021, the St. Lucia Medical and Dental Association predicts for the subsequent 4 weeks total positive cases reaching the 6,000 mark, with 90 deaths and a total of 1,400 COVID-19 patients requiring hospitalization. Out of that number, 800 being moderate, 400 severe, and 200 critical. This juxtaposed against the capacity of the healthcare sector, with the respiratory hospital having 127 beds, 3 ICU beds, 7 adults and 1 neonatal ventilators, and 8 high-flow oxygen machines. The document further lists the consequences for the dire prediction, among them an overwhelmed healthcare sector, a reduction in the number of healthcare workers as a result of infections, and increased mortality. So, what is the St. Lucia Medical and Dental Association recommending that the government does to avoid this very dire prediction? 1. The immediate ramping up of the contact tracing activities to identify the infected for isolation and contacts for quarantine, plus a contingency plan for ill COVID-19 patients. 2. Immediate ramping up of measures to ensure isolation of infected, both symptomatic and asymptomatic. 3. Immediate ramping up of case identification through testing and commencement of vaccine registration and administration. 4. Mass vaccination. 5. Education campaign. 6. The establishment of a minimum standard set for all measurable performances and an escalation plan if the targets are not being met. The St. Lucia Medical and Dental Association has assessed the cost of the detailed national emergency strategy for stopping community spread of COVID-19 at $14 million EC. Stanley Lucian for the HTS News Force.